Hi friends, welcome back to my YouTube channel. So last few months have been a bit hectic, so I'm trying to find time to actually record more, and thank God today is not so busy, so I'm taking this opportunity to record, and perhaps you can get some benefit. So today I'm going to share with you a few tips on how to maximize your cheap loupe, to use it, utilize it before you invest in a much more high-end or branded loupe lah. Do watch until the end, and perhaps if you want to skip, I'll put this timestamp below. First tip is actually to buy loupe at the minimum of having 420mm working distance. Do not buy anything less, because in reality, yes, in the old days you will be working very close to your patient, but now with COVID, with all this concern of aerosol and whatnot, and perhaps nowadays people are more aware of ergonomic, then you need to actually buy something that is at the bare minimum of 420mm. So if you buy a loupe, if you bought a loupe that is something below, then it's not going to help you at all in terms of ergonomic. Maybe slightly, but in the long term not. So in this manner, if you want to buy a cheap loupe, buy something that is around 420mm in working distance at least, and 3.5mm, 3x, 3.5x magnification at the bare minimum. So these two factors. So at a minimum of 420mm in working distance and 3.5x in magnification. Number two is about setting the scope to the steepest declination angle, because if you don't know how to set up your telescope declination angle, you will end up needing to bend down so much because you are setting your scope angle very poorly. So in this manner, you can see that in order to actually maximize the ergonomic benefit, you need to actually change the angle and ensure that you are actually putting at the most steep declination angle that is permissible with the frame. And this is why if you look at loupes, for example, Sagitel or Heine, they have their own mechanism to actually maximize the declination angle, to actually go even steeper than most loupe, to provide the safest angle for working in terms of your declination angle of the neck lah. And then this is why the only true ergonomic benefits, you could say, if you are actually looking at working at a posture that is very straight, for example in using microscope level posture, then perhaps you need to look at loupes that have deflection technology, such as Pentax. Number three is to start using your cheap loupe for everyday dentistry. Start with basic checkups. Yes, in my experience, the first time I use it, it's very daunting, because especially when I'm bringing my probe into the patient mouth, because the blind spot is quite huge from picking up the instrument and working into the working distance. I'm bringing the instrument into the working distance, so it's quite daunting. You are afraid that you might poke the lip and cheek. Yes, it can happen. So start with basic examination, use mouth mirror, get used to the working area and the field of view that you have, and then slowly and gradually work scaling, basic filling. I feel that's the two basic things. And if you are really confident, then go with endo. Perhaps going with endo is much more easier because your field of view is much more smaller. But to work and take instrument while doing endo with such a small field of view is going to cause trouble. Alright, so start gradually. Number four is actually to adjust your, to maximize the ergonomic benefit, is to learn and adjust your chair, your posture, and also your patient chair. For example, your patient chair, you can actually make it much more supine, so that you can actually see more in terms of the field of view, working area, when patient is actually in supine position. But of course, this is why you need to buy something that is at the minimum 420mm in working distance, because if you have something less, then you cannot even put patient in supine position, and patient need to be slanted very high up, and you'll be working in this posture like this, and then it's not going to be of benefit to you. And with loupe, when your head or your neck is bending down with the weight, then your neck will be in pain. Alright. Number four is to actually learn how to adjust and be aware of your posture. Change your patient chair position, your own position, working area. Learn how to get used to it. And the most important part is actually to get a feel whereby when you are working on some things, be aware of your body, and especially the strain or the pain. For example, when you are giving anesthesia, most of the time we will be working in a straight arm. So when you are giving anesthesia, you feel the strain, then relax your shoulder muscle, your calf muscle, and then that's how we go about it, meaning you are not actually just using the loop, but you are actually practicing awareness in your own posture and ergonomic. Number 5 is to use the loop consistently until you get a feel for it. This is the same whereby you are actually learning something new, be it driving, be it playing guitar, learning piano. So when you are learning, you need to be cautiously, you need to be present at the very moment and very conscious, very alert on everything that you do. But over time, when the muscle memory kicks in, or when the muscle memory has been internalized and you get used to it, it almost becomes second nature. So for me at least, I would say that the learning period to actually get used to it, not to say to be very proficient in it, just to be to feel that the loop is not causing problem to you in your clinical dentistry, it might take 2 weeks, the fastest. Some, yes, maybe about 1 week. On average, it's about 1 to 2 months. So you need to be, what I would say, to be comfortable and to accept that this is the period whereby you will be having your productivity reduced when you are using loop. So only after you get used to this period and you are using it daily and you feel that the loop is not hampering you, it's not causing friction, then slowly you can get the benefits, the full benefits of magnification and loop. So that is, for me, the key things that you need to understand. Because if some clinicians, when they struggle in this period, they simply just give up. They become frustrated and give up, especially when they are doing very complex procedure. So start small, start with very basic, very safe procedure until you get the feel for it. Now, you are wondering, it sounds too good to be true. Yes, I must admit that there are some, you could say, downside or negative when you are trying to force yourself to use loop. Number 1 is the loop will make you work very, very slow. You will slow down, not only because you are getting used to it, but rather because you can see more. And when you see more, you tend to not go faster. In caries management, for example, before wearing loop, I myself, when I saw, okay, this is caries free, all right, no unsupported number, but when I use loop, then I can see for a fact that there is caries. And using caries dye detector, it aided me to actually see much more precise which area that I need to remove and which area to avoid. The same goes when I do scaling. Nowadays with loop, I just cannot work without it. Because when you see the calculus fling from the gingiva, then you feel a sense of achievement and satisfaction. And that is the thing for me, I cannot go back without it. For me, yes, you must understand there are some short-term downside. Besides just having your productivity slash or having these periods of discomfort or feeling that the loop is actually fighting against you, it's actually much related to the feature of a cheap loop. Because what happens is that when you buy a cheap loop, the field of view is very small. When you have a small field of view, you have a big blind spot whereby you are struggling to take instrument and then bring it into the working field. Scaling, filling, it might cause problem, but basic examination for many is not going to cause any issue at all. And if you do endo, perhaps it will help in some extent whereby you bring the instrument into the field of view, then you are okay, but before you bring it, you might have some friction. So this is why, after you get used to the cheap loop that you bought, perhaps you need to find something that can offer a wide field of view. And this is, for me, the important feature to actually look. It's not about finding something smaller in terms of modification to compensate for a bigger field of view, no. But rather finding the modification that you need. For example, about 4x at a bare minimum, 4.5, 5 or 6. But to actually find something that can accommodate a wide field of view. And this is why it is interrelated to working distance. I've spoken on this matter before. I will put a link or perhaps description in the link in the description below, so you can look and jump to actually listen to this part, to this factor. Alright, regarding my posture, I need to change to the posture that I am accustomed to. Because with loop, you need to have a certain posture to get the maximize the ergonomic benefit. So for me, it's a conscious decision, and by learning on the right posture, I changed my posture to work safer. Initially, I thought that probably I would miss it, but after 6 months of using Loupe and with a much more comfortable posture, I don't really miss my old posture anymore, and my patient position is totally different from when I started doing dentistry without Loupe. So now I don't even I cannot even recall what is my last posture. It's just now my posture, my position, patient posture is just second nature. To the point that if there is some deviation from it, I feel that it's macam uncomfortable. So now I don't miss it. I don't miss doing dentistry without Loupe anymore. I am perhaps very dependent on it. You could say I'm very dependent on it, and I could not go back without it. Right. So that's all for today. Bye bye.